Welcome back, everybody. We are delighted to have Dr. Crutchfield from Crutchfield Dermatology, a leading dermatologist in the country, with us today. Hi, Dr. Crutchfield.
Hey, good afternoon.
How are you?
Happy sunny day.
No kidding. Okay, so tell us about the new product that's on the market that we should all be excited about.
Yeah, this really is exciting. It's a new wrinkle fighter, and it's very similar to Botox Cosmetic, but it's a completely different product. It's called Dysport, and it just got FDA approval about a month ago, and it just arrived in the United States last week. So there's actually a legitimate competitor to Botox Cosmetic now.
Did we need a legitimate competitor to Botox?
You know, I think in all industries it's good to have competition because that will make sure that the other products stay on top of their game, the quality is high, and also will bring down the price a little bit.
It will.
Oh,
okay,
that'll
well,
be
that's
nice.
a good thing.
A little bit, not a lot of bit, though.
Not a lot. Well,
they're very careful in their pricing. They realize usually they'll come in at a 5 or 10% less. But, hey, I'll take 5 or 10% anytime.
Oh, yeah.
Dr. Crutchfield, what's the difference between those two? Why would you, as a consumer, why would you want one over the other?
Well, when you're talking, the botulinum bacteria makes an enzyme. And really what happens with the enzyme is it can relax your muscles. And when I was a little kid, my grandmother used to always say, don't eat any food out of a dented can because you could get botulism. And what it really does is it causes the muscles of breathing or respiration to slow down so you can't breathe, and that's how people would pass away. Now, the amount that you use for a cosmetic treatment is about 300 times less than that, so there's never been a problem in that respect. But the reason, and the enzyme itself, there are 7 different types, but this is the same variation of the enzyme that Botox Cosmetic is. And the nice thing, it's very, very similar. It's kind of like Coke and Pepsi. Why should you have 2 cola drinks? Mm-hmm. Well, some might work better in some patients, and one work better in the other patients.
Okay.
And that would be
I like
something.
the Coke and Pepsi.
Yeah, that you would
it's very
just,
similar. It's very much like that.
And you would just ask, you would just, based on the person's skin type and that type of thing, they would be able to. You would be able to tell which would work better for them. You know,
what I'm going to do with a lot of my patients that have been used Botox Cosmetic for a while, because the Dysport is a little less expensive. Mm-hmm. A lot of patients are going to try one on one side and one on the other, and then they'll know what works best for them, and then they can make the most cost-effective choice in the future.
Oh, I like that.
All right. Now
okay,
we've seen Brooke Shields is everywhere, being the spokesperson for Latisse.
Yes.
The eyelash growing stuff. Tell us about that again.
Well, that's something that we've talked about on your show probably for a couple years now, and you guys have tried it. And it's a molecule that was first developed to treat glaucoma, but they realized in the patients they were treating, all of a sudden their eyelashes are growing like crazy. And so they did an application to the FDA for approval, and that was approved about 4 or 5 months ago. So Latisse is a treatment that makes eyelashes grow longer, darker, and thicker. And it's very similar to the Lilash product that we talked about a couple of years ago.
And how much is it again?
It depends. It ranges anywhere from, we're offering, if you do a cosmetic treatment, for $79 starting next week, but it can go up to about $140. On average, I think most drugstores are selling it for about $119.
Okay. For the Latisse?
Yes.
And you can buy that at a drugstore?
You can buy it at a drugstore with a prescription. So some physicians will actually sell it out of their office. Some will write a prescription for you, and you can go pick it up because it's not covered for insurance. And that's what I think Walgreens and Snyder's are charging, around $120.
Okay, tell us about, now we had a caller call in, and her son has terrible acne scarring on his shoulders and back.
Yes, and that's always so challenging and difficult to treat, and I like to be aggressive in my acne treatment so patients never get to that point. But sometimes you run into a patient and they're at that point. So we've got a laser called the Pixel laser that's really good at smoothing out the texture of skin. But I tell patients, listen, I don't want perfection to be the enemy of very good. We're looking for significant improvement, maybe not perfection, but when you look in the mirror, you say, hey, it looks better, I'm glad I did it. And we do some other things. We can do some filling agents and stuff like that. But we've got a new laser that tends to work very well for acne scarring.
Okay, go ahead, Lori. What?
Okay, so
we're raising our hand here, Dr.
We're raising our
Crutchfield.
hands because there's been so much breaking news. So I'm looking through my Elle magazine a couple nights ago, and this caught my fat melting laser. Has the day come when you can shed fat without a diet, exercise, or surgery? Possibly. Expecting FDA clearance this summer is Zerona, a non-invasive, pain-free laser that claims to release fat. What do you know about that?
One of the things that I did when I first started in practice, I developed a network of other plastic surgeons and other cosmetic dermatologists around North America, both in Mexico and Canada and the United States. And anytime something like this comes out, I jump on the horn, I call them all and say, hey, what do you know about it? And the word back on this one, right now the jury's still out, but it might be a little bit more hype than reality. But the jury's still out, and we haven't seen any super dramatic results yet.
All right, fine.
Oh, it sounds so good,
It sounds great, and everybody wants something like that.
Well,
Doesn't
fat
it?
melting laser.
Sign me up. I'll take 2 of them.
Someone called us about that yesterday, and I'm like, oh, sign us
so
up.
the jury's still out on
The
this
jury's
one.
out, but and a lot of the laser companies, they're good at marketing. They'll get their spin out there and get the word out ahead of time. But the people that are aware of it, they said they're still waiting to see some of the dramatic results.
Because why would you want to take it? I mean, it'd be like $500, or you'd spend $1,000 and nothing happened. I'd be so pissed.
Yeah, no, it can be frustrating at times.
Yeah.
And what about people who talk about the lips, the French lips? I know that the lips start to sink in a woman at a certain age, but everyone
and men too,
but everybody is kind of afraid of that pouty. What's her name?
Meg Ryan gave everyone a bad lip.
She got us all afraid.
I know. I tell you, we treat lips all the time, and we treat over 1,000 patients for lips. And everybody says the same thing. I want to have nice, natural, full-looking lips, but not like the First Wives Club.
Right,
Don't
right.
want it like
remember that Goldie Hawn? Hers were huge.
Right. And I have a friend who's a surgeon in California. He does hair transplants, and I said, do you find it odd because hair transplants sometimes they can look kind of fakey? And he started laughing. He said, those are the bad ones. He said the good ones you never know.
Right.
And the same thing with lips. There are so many patients that have their lips done, but they do it in a very gentle, subtle way. Less is more. And they look so great, you think they look natural. You just don't know they've had it done. So the other thing, too, is when you look at younger people, and when I say younger, people in their 20s, maybe early 30s, but what happens is there are 2 little vertical lines in the center of your lip that kind of run up towards the nose. And those tend to be very prominent. With time, those flatten down. But often when you do a lip treatment, you can re-accentuate those, and it makes the lips look really, really young and fresh. And so that's kind of the French lip, or accentuating the Cupid's bow. And that's another thing that we do, and patients really love it.
Okay, so that's Lori picked up the mirror and looked at her lips immediately.
Yeah.
Do you know what I'm talking about? Those 2 little lines that run up and down kind of in the center?
Yes, I love it. We're trying to achieve freshness because we might have expired past our dates.
Well, we didn't fit into that when you're talking about younger category.
Well, I hear a big day's coming up, but I shouldn't maybe say too much about that.
Oh, yeah. I've fought it for 2 years, and now I'm just accepting it.
That's great.
Yeah.
She looks great. And then is there and then that other one great product of yours that we love, the
Melashade.
Melashade.
Oh, yeah, Melashade it's a really super great facial sunscreen.
Did you make that? Did you develop that?
No, I didn't develop it. I work with a pharmacist, and he's out in Connecticut. And he's like a whiz kid, but he came up with this, and it's actually got melanin, which is a natural sunscreen. And the nice thing about Melashade is you can put it on if you wear makeup. Makeup goes on top of it beautiful.
It does.
It's like a
so
primer.
Say they'd love to put it down and then put their makeup on top of it. So it's great for protecting the face against sun damage.
Mm-hmm. Oh, no, it's wonderful. All right, we have to leave you.
Okay, well, I'm just so happy to announce that Dysport, the new Botox, is now available in the United States. And we've actually treated about 12 patients, and I saw them back this week, and they're all doing great, and they love it.
Oh, good. Thanks, Dr. Crutchfield.
Okay.
Okay, we're going to take a quick break, and we'll be right back.